There are some big changes coming to Medicare Advantage plans in 2025, and one of the most heated debates has been, will these changes be for the better or the worse? So let's compare plans from 2024 to 2025. Now, if you watch the news at all, you're probably aware that there have been many heated debates on Congress's floor regarding the future of Medicare Advantage. Medicare Advantage plans have become so popular that over half of eligible Medicare beneficiaries are enrolled in one, but there are some major downsides. For example, there's the issue of restrictive networks, which can sometimes leave a vulnerable population having to travel extensive distances to receive medical care. Then there is the major issue of pre-authorization, meaning that if your doctor recommends a specific service or treatment, your insurance carrier must first approve it as well. This can sometimes lead to delays of major medical treatment or even denials. And due to this issue of pre-authorization, as well to issues of payment, many hospitals and doctors are no longer accepting Medicare Advantage plans. And unfortunately, these changes often happen mid-year when beneficiaries are already enrolled in those plans. Still, as I said, these Medicare Advantage plans remain exceedingly popular. So there have been calls for reform for Medicare Advantage plans, either to install more competition amongst the Medicare Advantage plans themselves, or set stricter benchmarks, or even just improve original Medicare to make it more competitive. Now, unfortunately, it doesn't look like these changes are going to come to fruition in 2025, but maybe 2026. What do you think? So although these changes are not going to happen in 2025, there are, of course, other changes that tend to happen on a yearly basis. So let's compare the plans from 2024 to 2025. But before we do, a very brief pause to remind you to please like and subscribe to stay up to date, especially during this very important AEP, Annual Enrollment Period. If you have questions about your Medicare or health insurance in general, you can reach us in the comments below or at the number on the screen. We are licensed nationwide and there is absolutely no charge for our services. All right, let's get to the plans. So I'm coming to you from the past where we are looking at 2024 plans. So let's take a look so that way we can compare with our 2025 plans and see which are really going to be better. I'm going to put in a zip code, a Florida zip code. We're just looking at Medicare Advantage plans. We're going to put I don't get help from any of these programs. And, well, actually, let's compare some drug costs. Keep things even. Let's put in Lipitor, add drug. Let's actually keep the brand there. Add to drug list. And let's add another one. I think this is a blood pressure medication. There we go. Done adding drugs, so just so we can compare. And let's put in some pharmacies. I'm going to put in that same zip code, or actually it's already populating that for me. Let's just do mail order, Publix, Walgreens, CVS, and Walmart. There we go. Okay. So we have 60 Medicare Advantage plans available to us. And let's see. I will be honest, Medicare Advantage plans are really, really hard to compare because, you can look at the costs, you can look at the benefits, but some of the things that you don't necessarily know as much about are sort of the most important things. For example, how wide those networks really are, how widely accepted your plan is, and then just in general, how easy it is to get pre-authorization from your plan. That's a reason you might want to work with a broker. Okay, so let's see. As I said, we have 60 plans. Okay. This is an estimate of our total drug and premium cost, $13.99.29. But this one, we're looking at $0 monthly premium, $2,900 in-network, $2,900. Well, these are remarkably similar. UHC, Medicare Max, Medicare Advantage, Florida HMO. Oh, well, 00290002. I wonder what the difference between those are because they do seem remarkably similar. Let's compare those. Here's a PPO. We love PPOs, way more flexibility. Actually, let's compare those three just for right now. Let's take a look. Okay. Oh, this plan got Medicare's highest rating, 5 stars. That doesn't necessarily mean that it's a great plan, but it does have a good rating. Okay, let's see. So these plans have the same in-network out-of-pocket maximum. This has a higher out-of-pocket maximum. PPOs do tend to have higher out-of-pocket maximums. Of course, in and out-of-network is going to be higher, $5,100, than just that in-network maximum. Let's take a look at the benefits. So these plans, HMOs, do seem to offer a few more benefits, but when you are looking at Medicare Advantage plans, really the most important are your primary benefits, not these extra benefits like hearing and dental and whatnot. I'm going to go back. Let's see. So $0 copay for primary care, PCP. If it's in-network, $0, $45 for out-of-network, 0 to 10. For specialists, 0 to 35. So yeah, you're pretty much always going to notice that the costs with a PPO are going to be higher. But again, it just affords you so much more flexibility that it's often worth it. 0 to 80, 0 to 140, plus that 40% coinsurance if it's out of network. Okay, always covered. Okay, so here's the first difference I'm seeing between these two plans. 0 to $50, and this is just $0 for urgent care. In network, $280 per day for days 1 through 5. Interesting. Well, that's very interesting. $280 for days 1 through 5, and then $0 for $0 for 6 through 90, and 0 for 91 and beyond. Let's see. These numbers are looking pretty similar. Skilled nursing facility, slightly different. And here's our prescriptions that we put in. That all came out rather similar. Now, of course, if you want further details, you click on the plan details. Oh, thanks. Let's go back to plan results, because that's really comparing what's available right now amongst each other, but we are going to want to compare them to the 2025 plans. So we have a UHC, Medicare Max, Medicare Advantage, this other Medicare Advantage plan that we looked at. Here was the PPO. Let's see here. So $13.99.29 seems to be our cost that we keep seeing over and over again. That is basically it's just for our prescription drugs. Okay, and I'm noticing we have some lower out-of-pocket maximums. Let's actually filter by, let's see what else we want to look at. So let's remember, we've got a couple of plans with a $2,900 out-of-pocket maximum, which is pretty low. But again, those are HMOs. We're looking at that $13.99.29 for our prescription drugs. Slightly higher. Let's look at how many PPOs versus how many HMOs. Plan type. Let's look at strictly PPOs. So we had 60 plans, and now we have 20 PPOs, so that means 40 HMOs. Here's the PPO plan that we were looking at before, $13.99.29, $13.99.29, $13.99.44, slight increase. Some slightly higher out-of-pocket maximums, $10,000 in and out of network. This one actually has a deductible as well. But that's what makes Medicare Advantage plans so very difficult to compare, as I mentioned. So like if you were to look at the numbers for this plan, right? We're looking at Aetna. And we see that it has a $770 deductible, whereas the other plans that we were looking at didn't have any deductible. It is a $300 drug deductible. No drug deductibles on those other plans. $10,000 in and out of network. $6,700 in network. And those numbers seem a lot higher. And then we look at these benefits over here. And if you were to just look at a snapshot, well, this doesn't necessarily have all of the benefits. No, it's comparable to that, but it doesn't necessarily have all the benefits that some of those HMOs did. However, if in your area, Aetna is widely accepted, and most of the doctors, specifically this Medicare Advantage plan, let's say a lot of the doctors accept this plan. Well, then, even though looking at these numbers, it seems like this plan might not be as good, it actually might be better, because if you can get more doctors and hospitals to accept it, then you're going to save money as opposed to having to go out of network. Okay, time to compare to those 2025 plans. Let's take a look. We're going to put in the same information we put in before, but now we're putting in for 2025. Same zip code. We're just looking at those Medicare Advantage plans. We're going to put I don't get help from any of these programs. We will put in these same medications. All right, so let's put in that same Lipitor. Add drug. Keep brand, and we will add one more. Okay, add drug, add to my drug list. Done adding drugs. Let's do those same pharmacies. Mail order, Publix, Walgreens, CVS, and Walmart. All right, moment of truth. Let's compare these plans. All right, so before we had 60 plans, now it looks like we have 57 plans. That was unexpected. Let's see if I can find some of the same plans that we were looking at as well. Aetna, I believe one of the first plans we looked at before was a UHC plan, United Healthcare. Let's see if I can find that one. Actually, it will filter up here just so we can take a look. But it looks like based on how it's filtering right now, lowest drug plus premium cost, that is no longer the best plan for me. Oh, these are definitely some major differences. Wow, yikes. Based on the information that I put in, before we were looking at something like $1,300, and now the best plan for lowest drug plus premium cost has jumped up to $5,597. Now, I'm going to guess that is because the Lipitor is not covered at all. We'll take a look in just a minute. But let's see if we can compare directly to the plans that we had before. So let's look for United. Apply. Okay, so here's the plan that we were looking at before. That 0029 plan. Okay, so it's gone up pretty significantly, that total drug and premium cost. Again, I am going to assume that these dramatic increases in costs that we're seeing are solely because the Lipitor that I entered, the brand name medication, is not covered by these plans. But we're going to take a look more in depth in just a moment. So obviously a very different total drug and premium cost. The health deductible remains the same. Before there was no drug deductible. Now it's $175, and the out-of-pocket maximum remains the same. Let's compare to the other plans as well. The other one was the UHC preferred. Oh, here it is. All right. Let's add this one to compare. And the last one was an AARP plan. So let's actually just filter by PPO, apply, and see if I can find that. I think here it is. Oh, okay. So it looks like the other plan that I wanted to compare to actually isn't available anymore. That was that AARP 0026 one. Let me know if you're seeing anything different on your end, but I am not seeing it. So I will add to compare just for the sake of this video. All right. So this one is, maybe not my best comparison because it is a different plan, but I wanted to put it on there just for the purpose of this video. Okay. So first and foremost, the premiums for these plans have remained the same, which is there's no additional premium other than your Part B. The health deductible has remained the same. Both of these plans added a drug deductible. Both of these plans, their out-of-pocket maximum remained the same. This one, if we were comparing it to that 0026, which unfortunately is no longer available, this has a much higher drug deductible, and the out-of-pocket maximum is drastically increased. I'm thinking this is probably not the best point of comparison. Let's take a look at those benefits from these plans from last year. So the formatting has changed slightly, but it's looking like these are pretty similar. Let's take a look at some of the benefits and copays. So this is the same. Diagnostic tests and procedures has unfortunately increased. It was $25 before, and now it is $40 on this plan. On this plan, it is the same. These costs have increased as well. Now, that's not certainly anything to be unexpected. Generally speaking, costs do tend to increase slightly. Not all, but some. We're just looking for things that have increased dramatically, basically. Like the fact that I'm pretty sure the Lipitor is no longer covered. That is a huge problem now because your costs have gone up by thousands of dollars, basically. These costs have remained pretty stable. These costs have remained pretty stable. Now let's get down to the big problem. Yep, there it is. 1 of 2 prescription drugs covered. 1 of 2 prescription drugs covered. So that's really the biggest issue, is that our prescriptions are no longer covered, or at least the Lipitor is no longer covered. So actually, let's look at plan details, and that'll break it down a little bit further, and you'll see what the issue is here. Scroll down. Yeah, so the thing is, for one medication, there's actually no copay whatsoever at any of the pharmacies and at any time, and the other one is just not covered at all. So that's what the huge increase is there. So based on this information, are the plans better? Are they worse? Well, I mean, most of the benefits have remained pretty stable. Costs have remained pretty stable. But the huge setback is that one of those drugs is no longer covered. So if that were you, if you were somebody that needed to take brand name prescription Lipitor, then you would be in pretty big trouble. That would suddenly be very, very expensive. So what should you do if that's you? Well, of course, the first recommendation is always to try to take a generic if you can. If you cannot, if a generic is just not an option for you, then you need to look into drug discount cards. You need to look into programs like GoodRx. Very often, many pharmacies will sort of run different discount cards automatically for you to give you the best price. You can ask your pharmacy if they're doing that. Look into state pharmaceutical assistance programs. Sometimes states offer specific discount programs based on certain populations or certain needs, especially Florida definitely has a state drug discount program that you may want to look into. And then also there's something called pharmaceutical assistance programs. And that's if you've ever watched those prescription drug commercials and at the very end and very, very fast, they say something like financial assistance may be available. So if you need to take a specific brand name prescription drug, then sometimes there is financial assistance available for that specific brand name drug. You need to go to that drug's website to get more information. And of course, in 2026, many of those drug prices are going to be negotiated, so hopefully that will help you out a little bit. But yeah, if you were somebody that needed to take a brand name, then you would be in a little bit of trouble this year. Let's go back. I want to look in general. So obviously, if that were you, then the plan's quality would have dramatically decreased in 2024 because one of the 2 prescriptions that you took is no longer covered. I want to look at some more generals. So 2024 versus 2025. So based on the information that we put in, I'm actually eliminating the drugs right now. In 2025, it looks like there are 57 Medicare Advantage plans available. In 2024, it was 60. In 2025, let's take a look at PPOs. There were 15 PPOs out of, 57 available. In 2024, there were 20 PPOs. Ooh, so that's definitely not a trend that we like. Let's see what else I want to look at. In 2025, of those 57 plans, let's see how many include prescription drug coverage. 48 include prescription drug coverage. In 2024, let's clear this, 53. Ooh, so trends are still looking better for 2024 than 2025, in all honesty. I also want to look at special needs plans. That's the last thing that I want to look at. So in 2025, let's see how many D-SNPs are available. 92 D-SNPs, that's pretty good. And now let's take a look in 2024. 90 D-SNPs. Okay, so based on the information that we put in, I have to say that the Medicare Advantage plans, based on the zip code that we have put in, seem to have decreased in quality just a little bit. Now that's talking about costs and, of course, the benefits offered. That being said, the one thing that is so exceptionally hard to quantify or qualify regarding Medicare Advantage plans are networks. And that's sort of one of the most important things is how broad are these networks? How many doctors and hospitals accept these networks? And that's not anything that you can tell from Medicare.gov. That's not anything that you can see from here. So I would definitely encourage you to speak with your doctor, find out what plans they are planning to accept in the coming year, if there are plans that they plan on dropping, that type of thing. And of course, it's very important to work with a broker because there have been recent dissatisfactions with Medicare Advantage plans. There are many doctors and hospitals who are dropping plans even mid-year. You don't want to be enrolled in a plan that is currently in some type of contractual dispute, and then your doctor or hospital ends up dropping that plan mid-year. If you want to learn more about Medicare Advantage, and specifically the Medicare Advantage AEP for 2025, I'd highly recommend you check out this video over here. And if you have questions about Medicare in general, make sure to check out our Medicare playlist. As always, please make sure to like and subscribe to stay up to date, and feel free to reach out in the comments below or at the number on the screen with any questions. We'll see you next time.